A few weeks ago, we had an opportunity to head out to Disc Centers of America and talk with Doug Stidham about what makes his office so beneficial for anyone watching suffering with back problems. We had such a great conversation. We're back out again this morning, so thanks again for the welcome in.
It's good to have you back.
Something I did not mention last time, but I want to mention today is that you can really empathize with your patients because you've been a patient yourself.
I have been a disc patient. Between weightlifting, football, cheerleading, all that stuff, it ran a toll on my spine.
Right. So here you are, you're a chiropractor.
Yep.
And you still see patients coming in for just standard adjustments. You see that all the time.
A lot,
But
yeah.
you began to be concerned because you realized that there was a point at which your chiropractic treatments couldn't give the relief that your patient so desperately wanted. Is that right?
You just said a mouthful, absolutely. And it's not just my profession, it's physical therapy, chiropractic, both wonderful professions. If you have a disc bulge or a disc herniation, there's no physical therapy move that you can do to unherniate that disc. You can make the muscles around it feel better, but I have no problem saying that because as a chiropractor, there's no adjustment you can do to fix a disc bulge or a disc herniation.
Right.
And so as a young chiropractor, I got frustrated with that, but I was like, you know what? I'm not going to tee these people up for surgery if they don't need it. I'm just going to get some technology that can address it.
Okay, so that's a difficult line for you to have to walk, I would think, because nobody wants to live in pain.
Right.
And so sometimes surgery does have to be the answer, but you believe very strongly in these decompression tables that you have, and it doesn't take long for a patient to find out if it's going to work, and in fact, it's a 91% success
91.
rate.
You follow the protocols the way they're supposed to be done, and we have a 91% success rate.
That's unbelievable. So you mentioned a few things that you can treat: a bulging disc, a herniated disc, and then the
Advanced degeneration.
Okay, so can you have a bulging disc or a herniated disc anywhere in your spine, or does one area tend to be more prevalent than another?
Any disc can bulge or herniate, depending. Usually, if it's in the thoracic spine, that's usually from more of a specific trauma, whether it was from a car accident or a sports injury or something like that. But we tend to see lumbar is our 90% of ours, and then 10% are cervical, neck. But I'd say L5, the very bottom disc in your spine, is always the one. That's the biggest one that we have problems with.
Right.
But then, like, take my MRI for instance. When I started having problems, I knew I had a problem at L5S1 because of the radicular components. But on my MRI, I had a bulge at L4-5 and 3-2, also because, or 3-4, because it was there. It showed a bulge, but they weren't symptomatic. I didn't even know it.
Really?
Yeah.
So what did you do?
Well, I was aware of it, so the education was good. But then once I fixed my L5S1 with these machines, and then I started seeing new symptoms, I knew right away. I was like, it's that other bulge.
It's
that
something
wasn't
you have to
addressed.
stay on top of, right? I mean, I've heard doctors say if you sprain an ankle, it's almost worse than breaking it because the sprain never fully heals. It's always weak.
True.
So if you've had a bulging disc or a herniated disc, you can't undo that. You just have to find a way to maintain where it is and relieve symptoms. Is that right?
No, actually, if you have a bulge and you know there's a bulge, you could technically go in there, use the technology to unbulge it.
Oh.
So it breaks through those cartilage walls. When we do the decompression, it pulls the bones apart, and kind of like in a syringe. Have you ever seen a syringe where you pull back the needle and it creates a vacuum and it pulls the fluid up into the chamber? That's all we're doing, because the disc is actually adhered. It's adhered to the top and the bottom of the bones that surround it. So when you pull those two bones apart, you create this vacuum, and it pulls that fluid back to the center.
Okay.
Now when you pull that fluid back to the center, the cartilage can reattach and heal.
So does it vary person to person how long that holds before you have to come in and do it again?
Well, the thing I like about it is there's no downtime. So people are like, can I still work? Can I work out? Can I walk? And I'm like, you can do whatever you can do. Just if it hurts, don't maybe wait until you feel better.
Right.
But there's not really, a difference. I would say if it's a bulge, it's easier to fix. A herniation takes a little bit longer because there's just more fluid that has gotten out and put more pressure on there.
You had told me last time that smoking is a really big no-no because it's going to hurt. It dehydrates your body.
Yeah, unfortunately, I tell my smokers if they've got a disc herniation, I'm like, if you want to truly fix this and you want this to last, you're probably gonna have to give up smoking. But I think a lot of people that smoke today know there's risks involved.
Sure,
and
sure.
I think they just like their smoking.
Nobody wants to wag a finger. It's just that if you
Yeah.
hurt, at least that's going to be a potential problem. Coffee drinking also can dehydrate your body.
They can.
So if you come in, and we'll go back with the bulging disc because you say that's a little bit easier to fix, if you will. Doesn't take as
Yeah.
long.
Yeah.
So you get the bulging disc corrected, and after a certain number of treatments, is there an average? I know you like to see people 3 or 4 times a week, but for how long?
So a simple bulge, that's causing some minor problems. That'd be like 3 times a week for 7 or 8 weeks.
Okay, so 2 months comes and goes.
Quick season.
By Christmas, Thanksgiving, you're feeling great,
Absolutely.
right?
Different person.
You're a different person. Ho, 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 you'll say. Can you then go for quite a while before you need to come back in and do it again?
There's some people that never. I mean, I'm not saying you want to go out there and pick up the back of a car or catch an anvil or anything, but you could re-injure it. But the likelihood of you, as long as you make some modifications, like I say, if you've been a disc patient, a bulge or herniation, you probably never want to do deadlifts ever again.
Right.
It's just not a good idea.
Right.
And you probably need to modify how you do squats, maybe with dumbbells instead of loading up your spine and shoulders and whatnot. So if you modify well and take care of your body and move your body,
Yeah, then you're done.
you're good.
Okay.
Yeah.
If you are somebody watching and you have got not so much the back pain, but maybe you're noticing it coming down your arm or down your leg where it's pushing on that nerve.
Yeah.
And that's your primary complaint, that's painful all day.
Yeah. Yeah.
Once they get on the decompression table, do people often leave feeling better day 1?
They can. They can. People are different. I've seen both ends of the spectrum because bulges can hit a nerve root differently, different angles, so not everybody's the same. Some people will come off that table and they will think, I'm a messiah. And they're like, what? Thank you. It's so much better. I'm like, really? On visit 1? That's awesome. I didn't have that experience.
Right.
And some patients will come off and they'll have a slight muscle spasm. And they'll be like, I think it's a little worse. I'm like, well, let's put some ice on it. Let's get you walking, activate those muscles, and you'll probably be better. And they usually call me back and they're like, yeah, it's way better now.
Okay.
So,
People build relationships. They'll build relationships with you. They build relationships with their doctor. So if somebody's in the hands right now of an orthopedist, and didn't you tell me, by the way, that neurosurgeons are real keen on this?
oh yeah, the developer, this right here is the Bible of decompression. This guy right here is the godfather of spinal decompression. He's a neurosurgeon. He taught at Harvard.
Really?
Yeah, so why would a guy that's a neurosurgeon be looking at other alternatives? Because he wanted to get people well. And sometimes surgery and fusing the spine, even if it's done and executed perfectly, isn't always going to be the best option. And it can cause pain down the road. And so he's been the main pioneer through this over the decades.
Okay, so somebody has a relationship with their surgeon or their doctor, and surgery's being discussed, right?
Yeah.
And then they see you and they think, okay, I kind of want to give this guy a try, but will he be in touch with my doctor? Do you?
Yeah.
I'll let you fill in the blank because you know where I'm going.
I love to co-manage. So a lot of, there's not a neurosurgeon or an orthopedist out there that doesn't just want the best for their patients. And if they could, and a lot of them will say, you know what, they're conservative, and I love those doctors. And a lot of them will say, hey, if there's technology out there like this, utilize it. If we can keep you from having surgery, great. Because, the alternative is doing injections, epidurals, pain meds. All those things have risks and side effects. And a lot of times they'll, I had to have surgery one time. I think we mentioned that on one of the shows. My surgeon was, he was awesome. And he would have been whatever I needed or wanted. When I told him, hey, I'd like to do this, but can we do this? He was so, he was just very catering to my needs. So yeah, we get together, we can talk about it, discuss it. But usually if they've ordered an MRI, that's all I need to see.
I'm so glad that you mentioned that about your surgery because I had forgotten that. And I think it's really important to know that when somebody comes to your office, just like with their doctor, you want the best outcome for them. And you have sometimes had times where treatments like this were your best option, and sometimes it doesn't go that way. So you're not going to try to just guide people towards one path. You just want the path to be successful.
You hear the expression, when you're a hammer, everyone's a nail, right? That's not the case here. A lot of times people will see the technology and they're like, I want to get on that table. And after we do their exam, I'm like, I don't think you need decompression.
Right.
I don't. I think a good old-fashioned adjustment would be great for you. So it's patient to patient.
Come and see him. He would love to make you feel better, and it won't take long. 2 months for 2 or 3 times a week. You're 16 minutes on the table. table to 25 minutes when you're here, if you're even a candidate for it.
Just got to be consistent.
And come and shake his hand. It's Doug Stidham at Disc Centers of America. Their contact information right there on your screen. I'm sitting up straighter already.